avoid surgery. I don't want
anybody.
I don't want cutting, bleeding. I mean, blood transfusions if you can avoid it. Why not? So it's an open invitation. If you want to try to avoid surgery for your cancer, or if you've had prior chemo or radiation, think about all the treatment options out there, and I'd be happy to answer your questions either privately or in person or on the radio. So we're going to go to this commercial break. We have a tremendous sponsor who has the most beautiful voice I've ever heard.
Sounds very familiar, Doctor. And give us a call when we get back. 1-800-848-9222. And we're live.
Thank you very much. For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. At Radiosurgery New York, the radiosurgery pioneers, that's our goal too. We're first in America, first in New York, first for you with body radiosurgery. We hit your cancer from head to toe with no cutting, no bleeding. We have decades of experience with primary and metastatic, large or small cancers. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are the best results and quality of life. Hi, I'm Dr. Gil Lederman. For a free booklet and DVD, call 212-CHOICES. 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. We're super convenient, Broadway and 38th in Manhattan. Hyperthermia 2. To hit your cancer, call 212-CHOICES. 212-CHOICES for Radiosurgery New York. At Radiosurgery New York, the best prostate cancer treatment is custom-tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Custom prostate cancer treatment here is outpatient and takes as little as 1 hour. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Hi, I'm Dr. Gil Lederman. Call us at 212-CHOICES, 212-CHOICES for a fresh second opinion and a free booklet DVD. Conveniently located in Manhattan at 38th and Broadway. For your custom-tailored prostate cancer treatment, call 212-CHOICES, 212-CHOICES. Cherish your life with custom-tailored prostate cancer treatment at Radiosurgery New York.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WABC studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. Hey, Dr. Lederman, we're back.
Hi, it's Gil Lederman. Welcome back to the Radiosurgery Hour.
Here we are, Doc. Good morning.
We're live here at the ABC studios. We're from Radiosurgery New York. Our specialty is non-invasive cancer treatment. So before you do something, or if you're getting chemo, radiation, or surgery and it's not working or not tolerated, give us a call. You can call the radio show or call us after the radio show at 212-CHOICES. During the week, 212-CHOICES, and we have a free booklet and DVD. We have Jane on the line, who's from Lafayette, New Jersey, and who's talking about a high platelet count for many years and has been put on hydroxyurea. Good morning, Jane.
Well, good morning.
How are you?
Great. I'm so happy to talk to you.
Well, everyone gets to talk to me. Just call up 212-CHOICES, and you can talk day or night.
Well, this is the first time I'm hearing you. I have not...
I can't believe that. We're on 4 radio stations. We're on CBS FM on Sunday mornings at 4:30. Our first program will be tomorrow. And we're on WOR for an hour, 6 to 7 a.m. and 9 to 10 p.m. on Sundays. So are you the patient? Do you have a high platelet count?
That's me, yes.
And how old are you? How young are you?
How young are you, Jane?
Well, 72. I'll be 73 soon.
72. Eyes are blue?
Yes.
Oh, perfect.
There you go, Doc.
So you have a high platelet count, and you've been put on hydroxyurea. And are you taking hydroxyurea?
Yes, I am, every day.
And your question is?
What do you know about... they gave me a name, but I forgot what it is.
Thrombocytosis.
Yes, that's what it is.
And your question is?
I don't know anything about it.
Well, go look on Google on thrombocytosis. Thrombocytosis is one of the diseases that it might be by itself a unilateral disease, or it might be a precursor of a more serious condition. The bone marrow makes blood cells, and the bone marrow is like a factory, and it makes platelets. Platelets are used to prevent bleeding. It produces red blood cells, which take oxygen to the tissues and bring back waste products. And it also produces white blood cells, which generally fight infection. So platelets are one of the three forms of cells that are produced by the bone marrow. And the bone marrow, the body should be in a balance where it produces what is considered the normal amount of blood cells. Now, when the bone marrow goes out of whack, it might be it's a precursor or a sign that something's abnormal in the bone marrow. And for the platelets, if you have too many platelets, instead of preventing bleeding, it actually can cause blood clots and cause more serious problems like stroke. And so the hydroxyurea is a kind of chemotherapy, and it's actually a very old chemotherapy that's been around for decades and decades. And the idea of hydroxyurea is actually like a little poison on your bone marrow to slow down the platelets production. And that's what your doctors have most likely prescribed. Look, I haven't seen your records. I'm happy to look at your records if you want. But why don't you go on Google? Do you use the computer?
Oh, yes.
So just put in thrombocytosis or put down high platelet count, and you'll get thrombocytosis, and you can read for days and days and days. And if you have trouble sleeping, you can do it at nighttime, and it'll probably help you go to sleep.
Now, this hydroxyurea, should I be not taking it for a very long period of time? Does it matter, or? Well,
I don't know what your platelets. I'd have to really sit down. And, when I see a new patient, I usually spend an hour, 2 hours, and we sit and we go through all the records. So it's not really fair to you you've been on the phone for 8 minutes, and we've been talking only for a few minutes. So it's not fair to you to give you a diagnosis and a treatment plan on the phone. But give me a call during off hours, off the radio, the 212 Choices number, or come in. Or, first of all, read about it. Spend the weekend reading a few articles about it. You'll get a pretty good idea what's going on, and then let's talk again.
Okay, well, thank you so much.
All right, God bless you, and thank you.
Bless you.
Bye now.
Bye-bye. Thanks, Jane.
So we had an interesting patient also. Thanks, Jane. Gives us a lesson about thrombocytosis, which we have not talked about on the show, and I'm happy to do so. We had a patient with an acoustic neuroma, which is a benign tumor of the 8th nerve. The 8th nerve is one of the 12 nerves that come off the brainstem, these delicate nerves. The 8th nerve is responsible for hearing and balance. This woman has had an acoustic neuroma, which is a benign tumor of that nerve, for a long time. She saw me last year, and I told her, look, we can treat you or not treat you. I don't like to push people. Some doctors say, you got a brain tumor, you got to be treated Tuesday. If you don't get treated Tuesday, you're going to die. Well, that's not really true, and it's not fair. So I told her, look, it's your option, but you can also wake up one day and your hearing can be less good and your balance can be less good. And she's a beautiful woman, about 55, and she's single and dating, and she started getting worsening hearing and balance, and she was really frightened about it.
Sort of like a vertigo type of
something
sensation?
Like that,
yeah.
right. So not very steady on the feet.
Yep.
And she was dating, so she was a little bit embarrassed with her boyfriend, and she came to me 6 months ago. We treated her with non-invasive fractionated stereotactic radiosurgery, which is painless, non-invasive. There's no screws in the head. There's no hospital stay. There's no cutting, no bleeding. And we have the world's largest experience treating acoustic neuromas. So we've been doing it for a long time. We have a unique program, and it's very important to have a long track record because you want to know what the doctor knows. And there's only 2,000 acoustic neuromas a year in America, so it's a rare disease.
Yeah, sure.
And we kind of specialize in rare diseases because we're such a referral center. So this woman came 6 months ago, and we treated her, and she came in yesterday, and guess what? Her balance is better.
Wow.
Her hearing is better, and she was having fasciculations. Her face was moving involuntarily before
like
the
muscle
treatment.
movements in the face?
Yeah, because the nerve was irritated.
Sure.
And all those symptoms went away. So she's really happy. She had no side effects from the treatment. People asked, did you lose your hair or anything? No, she didn't lose any hair. She was fully functional. I don't think she even told anybody she had the treatment. And doing better with a brain tumor that if she went for surgery, she'd most likely be deaf, very high chance you'd have facial paralysis, and even 1% died during surgery. So.
And how long was this, Doc?
5 treatments. Each treatment's 15 minutes. Comes in, gets her treatment, and goes shopping at Macy's
I'm sure
across
she never
the street.
thought it could be that easy. You know,
yeah, probably she would have had the treatment years earlier if she believed, but that's why we're here. That's why we're telling the story on the radio and trying to encourage people to learn more about it or to get our book and DVD. Dr. Eisen's on the line. Dr. Eisen is a colleague. He's a man who was born in Argentina, is a fluent Spanish-English speaker, and his specialty is taking care of the Spanish community. He trained at Columbia Medical School in radiation, and now he has an exclusive practice at Radiosurgery New York. Good morning, buenos dias, Dr. Eisen.
Good morning, Dr. Eisen.
How are you today?
Good morning, Dr. Very good. How are you?
Muy bien, you were going to say. Right? Is that good? Is that good Spanish?
Sounds pretty good to me, Doc.
Yeah.
So we're almost at the end of the hour, but I'm glad that you called. Your specialty is taking care of Spanish people and people in their own language, right?
Yes, absolutely, and that's what makes the difference.
And I know that you spend a lot of time with your patients. I know sometimes you spend an hour, 2 hours getting all the history, answering all the questions in Spanish, not through a translator, in Spanish.
Right. That's the way. That's the way, and it makes a huge difference. Particularly in patients that they have very complicated disease, like this week I have patients with very, very difficult cases, and we are finding the way, taking it slowly, looking at the case.
Well, you did a great job this week. You had a patient I know about, a Spanish man who came in with prostate cancer, and you discovered brain tumors in him, which is really very unusual. And you found he had no symptoms. So congratulations that you found the disease, you started the treatment, and you arranged the medicines and the treatment, and you spoke with the daughter. You did everything you needed to do so that the patient and the family were well informed, right?
And the other thing that was extremely important is the way that we are working in a very, very relaxed way, in a very difficult situation with a patient, and very quickly we can just not only move ahead with MRIs or CAT scans referral quickly, patient comes back with all the information.
Yeah, same day. So they come back the same day. So we're just at the end of the hour, but please tell the listeners if they want to find you, speak to you in Spanish, how do they find you?
Okay, para español, el 917-836-8105.
Can we have another time in Spanish and in English, please?
917-836-8105. In English, it's 917-836-8105.
Thank you, Dr. Eisen, and thank you, our listeners. We're at the end of the hour. We'll have another live show on tomorrow, WOR, from 6 to 7 a.m. and from 9 to 10 p.m. It's live. You can call in your questions. And you're welcome to call in your questions today if you want a 212-CHOICES. If you want a private discussion, please call me at 212-CHOICES, which is 212-246-4237. We have a booklet and DVD to send you at no charge. Again, we're open in the heart of New York City, and we're happy to see your cases. Even if you had treatment elsewhere, the treatment didn't work or isn't tolerated, you want easier, non-invasive treatment, call us at 212-CHOICES. Thank you. Have a great week. Thank you, John.
Thanks, Dr. Lederman. Have a great weekend.
Okay. God bless you, and bye-bye.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. This is Rob Redstone. Till next week.
This is where New York comes to talk. Legendary 77 WABC, New York, a Cumulus station.
From ABC News, I'm Dave Packard, Day 5 of the From ABC News, I'm Dave Packard, Day 5 of the From ABC News.